actually about the patients and their concerns about the safety of the patients and what their work was going to look like when they got there come September 13th, which is Friday the 13th. But there were also stories of how this impacted, because one of the things that we heard was that there would be jobs at the end of the day for everybody. But now we're hearing that there's going to be bumping that carries on with this process, and there could be somebody who does fall off and won't have a job. The stories we heard from the nurses also on that day were, I'm a new grad. I've been working full-time since I graduated. I have just bought a house. Or, I'm the breadwinner of my family, and now I'm going to make half as much as what I did before. So we heard some really horrible stories. There was an LPN on the lawn afterwards who stopped me and said, you know, I chose to work on surgical for 7 years because I love surgery. And for me to stay on surgery, I had to take a part-time line when I should have been full-time, rather than go to medical. All those nurses are now going to have to be orientated to new units. They're scared because they're going to have to change. Yes, those are all entry-level jobs, but they're scared for their patients. And I think that that message needs to come through. And I think what you need to know is that it's not just the nurses who are concerned. And we have almost 4,000 petitions for you. And I know that Brandon and Lynn have been getting copies of the electronic, but we also have paper copies for you of paper signed as well as the electronic.